I'm going to introduce our speakers. First, we have the wonderful Dr. Priska Oakley Enum. She's under obstetrics and gynecology for Greater Accra Regional Hospital, Ridge. And then we have Dr. Abrefra Buzia Bismarck, surgery SHO at St. Elizabeth's Hospital. And we also have, lastly, Dr. Akofa Mototi Amuzu. She's under the pediatric unit, the University of Ghana Hospital, Legon. And thank you all for joining us.
What is cervical cancer? If we could get a scientific definition for it, what would it be?
Hi, everyone. So, cervical cancer, scientifically, we say it's a malignant tumor of the cervix. Actually, we don't have a baseline definition for it, but we try to make it more understandable to the layman. So, malignancy is just a worst part of the cancer, let's put that way, so we can all understand. So our body is actually made up of cells, and sometimes these cells can go out of proportion. So that's where the cancer comes in. And wondering what the cervix may be, for every woman has a cervix unless there's some surgery or anomaly. So the cervix is a part of the reproductive system that connects the woman's womb and also the vagina. Yes, so that's where usually these cells go out of proportion and comes cancer and can spread to other parts of the body.
But then, Dr. Kofa, so to the layman, if we talk about cervical cancer, is there any simpler definition?
The cells at the cervix outgrowing their proportion in an uncontrolled manner.
So, Doc, please take us through the data.
2019, that's here a statistic done in Ghana here, and about 3,151 people were diagnosed of cervical cancer, for which 2,119 people died out of it. And then with respect to the WHO, or World Health Organization research that was done, they said by 2030, about 550,000 people will be infected with cervical cancer annually or yearly.
Its survival rate is close to 100% if only it's detected early and treated early.
Yeah, the risk factors. We have early sexual intercourse, early marriages, early childbearing. Then when we say early, what do we mean by early? Early marriage, early childbearing, and then early sexual intercourse. And then why does early sex predispose our girls to cervical cancer? So when we say early, a recent research by the American Cancer Society shows that being sexually active before the age of 18 increases the risk of cervical cancer. And then in Ghana here too, we may be aware that vaccination for cervical cancer is usually targeted at the young girls between the ages 9 to 14, which suggests that our younger girls are sexually active. And then another research which was published in the Pan-African Medical Journal in 2019 also shows that in Ghana, about 14% of the adolescent girls between age 15 to 19 are already mothers, or they are carrying their first child. So these girls are prone to getting cervical cancer when they engage in early sexual intercourse, because their epithelial cells, like my colleague was saying, the cells in the cervix are immatured, and then the transformation zone where the cervical cancer also occurs are also not developed well. They are not well developed for these young girls, so they are at increased risk of cervical cancer later on in life. So that's what we mean by early sexual intercourse, early marriages, and then early childbearing. So when you engage in all this at an early age, it will predispose you to getting cervical cancer later on in life. Then we also have multiple sexual partners. The more partners you are exposed to, the more, though we didn't talk about the HPV virus, which is the main cause of the human papilloma virus, which is the main cause of cervical cancer. So the more you are exposed, the more sexual partners you are exposed to this human papilloma virus. So these are some of the, we have a lot of risk factors. And then cigarette smoking too. Those who smoke cigarette a lot, it's known that cigarette contains nicotine, which will destroy the cells, the good cells, the immunocompetent cells in the cervix, making them immunocompromised. So which can also predispose our girls and women to getting cervical cancer.
Okay. Host, please, can I come in here? Um, we are talking
Yes,
about
please.
risk
Yes.
factors associated. Yeah, we are talking about risk factors associated with cervical cancer, but we forgot to mention a common organism that should be present to help the cancer to turn into, it's like my colleague said, malignant, like the worst form of it. We have an organism called the HPV, human papilloma virus. So usually we take cervical cancer falls under sexually transmitted disease, that one of the viral um, diseases that affect the cervix, or and then predispose you to getting cancer. This organism usually we have about 100 serotypes of them. Okay, and we also have, among the human papilloma virus, we have those that can be transmitted orally, those that can be transmitted vaginally, those that can be transmitted through the anal, like our anus. By this time, we are talking about this one that transmits through vaginally, which we have types, a lot of them, we have 100 of them. And even among the human papilloma virus, which I'm going to be saying HPV, you bear with me, we have those that are high risk. That means if you come into contact,
I don't know if it's from my network, but I'm losing
with
Dr.
those ones,
Befa.
is very high.
Is it just me or is everyone?
No, I'm also losing him.
Okay, Doc. It's like your network is not
Okay,
really stable as at
okay.
now.
So can you hear me now?
Okay. Yes. Yeah, on now.
Yeah, we can hear you.
Okay. I was talking about human papilloma virus being one of the organisms that should be present before the cancer can, let's say, continue or progress. And I'm talking about that. I said it can be transmitted through oral, the vagina, or the anal, with respect to the type of human papilloma virus occurring at that moment. But with cervical cancer, the ones that are usually involved, we have those that have high risk, meaning that if you come into contact with this high risk type or subtype, probability of the disease turning or whatever condition being there turning into cervical cancer is high. We also have the low risk, which we'll talk about, the condyloma acuminata, which we won't go there. But human papilloma virus play an important role in cervical cancer. Let's take note. And um, according to the research I did in 2019, HIV infection puts the individual into getting the cervical cancer, in the sense that we have some let's say some immune systems at the cervix. We have the P53 and the retinoblastoma being there, but when the infection or the organism gets there, it tends to produce something we call protein. Like it produce something of it, and then now stop the immune system. Now I want to cause disease, so please stop your work, or I'll take over your work, and then I'll grow. That's the service. So if you are not eating well, because the immune system has to be well developed. So risk factors incompetent, like people who are taking cancer medications, HIV patients, their immune system are down. People who are not even eating well, low socioeconomic status play a role. If you are not eating well, you are not getting. And research done as at the 2019 also said that if you are not taking enough ascorbic acid, like the vitamin C we are talking about, carotene, retinol, the green vegetables, it also predisposes you to getting a low immune activity, which when the organism gets there, it can take over, and then now, so HPV is very important when we are talking about cervical cancer.
Okay, thank you very much, Dr. Abishwa. Thank you, Dr. Kofa. Dr. Preska, please, do you have anything you'd like to add to what we have said so far?
Yes. So with the risk factors, yeah, we are not saying like when these are there, definitely you're going to get the cervical cancer, but with the HPV, that's the human papilloma virus, it's like a main key to the cervical cancer. And also, some will say that, oh, it's a lady who is going to get the HPV infection, but the males also get it. So you might be, let me say, faithful to your partner as the lady, but if your partner, the male partner, is promiscuous, the risk of also getting the HPV is there. Also, research has not fully defined a genetic base for getting cervical cancer, but what they think right now is if first degree relatives, so that's like your mother, got cervical cancer at one point in her life, there's more than 40% risk of also getting it. Yeah. They are more 6 times more to get cervical cancer because they have a weakened immune system. So it allows the HPV to affect them more. I want to use layman terms so we can all get it. Yeah, affect them more. So that's the risk factors. We have those who use birth control pills for over 5 years because it's also the hormonal changes in the body can affect your immune system and also pose you at a risk of getting cervical cancer. So that's a little I'll add.
Thank you very much, Dr. Preska. Okay, so now I'd
So,
like to ask.
in addition to
Okay.
that, so those who are also on immunosuppressive drugs like the cancer medications too are also predisposed to this cervical cancer.
Okay. Thank you very much. So, people taking immunosuppressants. Now, I'd like to ask, how can we tell if someone has cervical cancer and the signs and symptoms a woman is to look out for in herself in case of suspicion of cervical cancer?
Okay. So when someone with cervical cancer comes, usually when it's the early stages, they may not show any symptoms. But as the disease advances, they may come with abnormal uterine bleeding. They may come to you saying they have abnormal uterine bleeding, post-coital bleeding when they have sex with their partners. Then they start bleeding. Then intermenstrual bleeding in between their menses. They may cancer women too will come that they've started bleeding or their menses have started coming. The late symptoms, they may come complain of pain during sexual intercourse. And then weight loss, when they come to you, see that the woman has lost weight more than 10%. They've lost weight, loss of appetite, and then they become offensive. They become offensive, and then if the cancer has spread to any part of the body, like the lungs, they may come complain of cough with blood and offensive. Sorry to say that. Uh, so they may come, you see them, as soon as you see them, you know, very offensive. And then when you pass a speculum for them to examine the cervix, you see obvious swellings on the cervix. So these are some of the signs and symptoms when they come around that we'll look out for. So if my colleagues can add on.
Okay. As we are talking about cervical cancer and the signs and symptoms, there are other conditions too that, or let's say diseases that can occur at the cervix. It could be only inflammation of the cervix. Okay, where the vagina, or maybe during the when the time the patient was having sexual intercourse with. But mostly testing or trying to test and see if the organism that causes the, like we said, the HPV is there, or taking some of the tissues to test for the cervical cancer or changes will usually help us know that really whatever is happening to the woman is there, because it could also be cancer affecting the womb, which we call endometrial cancer. But that one too can also present like that. So these are, yes, some of the symptoms that, yes, and mostly, let me talk about the cervical cancer. We forgot to talk about it having something called bimodal peak. That means it affects people within the ages 30, 30 to 35, and then the ages of 60 to 64. Okay, so the patient that will come, or the female that will come telling you that they have those kind of symptoms, usually fall within this kind of ages. Even though previously, like he said earlier, it's asymptomatic. The person may have no symptoms unless
I think we are beginning to
maybe
lose Dr.
after the person going to do something at the family. Hello?
Yes, we can hear you.
Yes, you can hear me now.
Okay. So I was talking about other conditions too, trying to present the same as the cervical cancer. So it's very testing and then investigations play a very important role in cervical cancer. So
Thank you very much, Dr. Abrifa. Dr. Presla, please, would you
you can
like to
continue from there.
add? Okay, thank you. Dr. Presla, okay, I think she's not here. So I'm going to give room now for people who want to ask questions to request so they can ask questions before we move to our next item. So if you want to ask a question, just put up the palm emoji. Just pick the palm emoji, the hand up emoji there, and then I'll just give you access to speaking, and then you can ask your question. Thank you. Okay, so Ilima's corner, you can unmute yourself and speak.
Hi guys. Thanks for
Uh,
letting me speak. I just wanted to clarify something. Talking about the risk factor for all these things, it's mostly things that, and I think Dr. Abrifa or somebody else said it, that makes you immunocompromised. And I'm not sure how OCP falls in that line.
Okay, I think Dr. Priska is in now. Doc, if you could.
Okay. I understand where Doc is coming from. So as Large said, it's a risk factor. I mean, it predisposes you to getting it. And mostly when we talk about risk factors, in some places they've done research showing that and then this research done with respect to the oral contraceptives has to do with women who are on it and women who are not on it. Okay, so I even during my research, I came across a study that was done in 2002, and they realized people or women who were on oral contraceptives, okay, and also had HPV infection. So it's not only doing has to do with having only the or being on the oral contraceptives or being only on the oral contraceptive. So it also has to do with they having risk factors like um, having the HPV infection, and in some of them too, women who are at risk of who smoke. So the study was done like with respect to those on it, and then those on even if you are on oral contraceptives, risk of getting oral contraceptive predisposing you to get cervical cancer takes about the study said at least 10 years. At another place that I read, they said about 5 to 9 years, and it increases your fall because of the research they done among some women who were on oral contraceptive and women who are not on oral contraceptive. So it's not only has to do with having the HPV or the immune system being compromised. It has to do with studies that have been done and then confirming that if you are on it, you stand the risk of getting the cervical cancer.
Okay, so what I'm getting from what you're saying, which is what I'm trying to clarify now, is that the study that is saying this, OCP in this situation is like a confounder. In layman term, like an additional thing, meaning that ideally it's not that the
Okay,
cervical, the OCP itself is what leads to cervical cancer. The study you're describing is kind of saying in people who have HPV infection already, they are likely to develop cervical cancer faster than those who do not have HPV infection if they are on OCP. So in that case, that's just what I'm trying to
exactly.
clarify so that people don't misconstrue the fact that they are on OCP, they might be at risk. Because if you don't have HPV infection, you're not going to get the cervical cancer, whether you're on OCP for 20 years. That's why I'm trying to clarify
Yes,
that.
and also
But if you
being
are on
on
OCP
OCP
and
and
then you have
and smoking is also one of them.
exactly. So you have like two things that increase your risk for cervical cancer together, and then you have the HPV infection. That's when you're likely to get it, but not in isolation, is what I'm trying to, because some people can take this out of context and then think that, oh, I don't want that OCP because I increase of my risk of cervical cancer. That's why I'm trying to clarify that part there.
All right.
Thank you very much for the questions. Is there anyone else who'd like to ask anything? Who'd like to say anything? Or okay, so then we move to our next item. Right. So now we see I was going to ask how we can do a test, but in the process of asking a question, there something came up about a pap smear. So if any of the panelists could just pick it up and explain to us how it's done and when it should be done, we really appreciate it. Thank you.
Okay. So the Pap smear, it comes under one of the preventive measures. So we have the primary prevention and then the secondary prevention. So the Pap smear will come under the secondary prevention. So I would like to quickly talk about the primary prevention. Then we go on to the secondary, where the Pap smear will come under. So the primary prevention, we now know the risk factors for that will predispose someone to getting cervical cancer, like the early marriages, early sexual intercourse, and all that, smoking and all that. So when we know the risk factors, then we try to eliminate these risk factors to prevent exposure to the HPV viral infection and then the other STI. So we tell the people to avoid smoking, limit sex to one partner, avoid multiple sexual partners. If it's not possible, you can use a condom, though condom is not 100% safe, but it's better than none. And then we also have vaccination. Like I said earlier, there is a vaccination which is targeted at the age between 9 to 14 years in Ghana here. Then there are two types of this the vaccines. We have the Gardasil and then the Cervarix. But the Gardasil targets four of these, the HPV, the types 6, 11, 16, and then the 18. And it's given to these young girls. It's given IM actually, 3 doses at 0 months. The first one, then after 1 month is given, and then in the next 6 months, it's repeated for 3 doses, and it protects against the four viruses that I mentioned, the types 6, 11, and then 16 and 18. And then the Cervarix, which is targeted against the high risk HPV, which is the 16 and then the 18, is also given at 0 and then 1 month and then 6 months apart. Then we go on to I don't know if any of my colleagues would like to talk on the secondary prevention. I should just go on to talk about the Pap smear and the rest.
Um, I think you can go on, but before that, I'd like
Okay.
to ask a question. Um, if you are beyond the age 14, can you still take the vaccine for
Oh,
the cervical cancer?
okay. So usually the target group is like the 9 to 14 are not sexually active. But the moment you become sexually active, then we have to go on and start screening you. That's
Okay,
the ideal. So the
okay,
screening is for those who are sexually active.
okay, okay.
Mhm.
Thank you. Thank
Yeah.
you. Um, Dr. Presta, would you like to say anything? Your mic has been unmuted for some time. Dr. Priska. Okay, Dr. Akofa, please give
Okay.
me. Yeah.
Okay. So when we go to the secondary prevention, which is the whole main thing, the awareness that we are creating to get screened for cervical cancer. So American College of Obstetric and Gynecology, they've given some age range, they've given a range. If you are less than 21 years and you are not sexually active, like I said, there is no need for screening. Screening is not recommended unless you are sexually active. Then 21 to 29 years, then we can do a Pap smear alone for you. For every 3 years, we screen you, do a Pap smear every 3 years. And then from 30 to 65 years, we do both the Pap smear and then take a sample to test for HPV virus. That's for 30 to 65 years people. Every 5 years is preferred. Or you can do a Pap smear alone for every 3 years, which is also acceptable. But if you are above 65 years, screening is not recommended if there is adequate prior what we've done for you from 20 something up to 65, there's nothing showing that you have malignant cells or you are not at high risk, then there's no need to screen you when you are above 65 years too. So we take the and the screening methods. We have a lot of them. We have visual inspection with acetic acid, which is the simplest one, and then the visual inspection with Lugos iodine. So the one with the acetic acid, when the person comes to the clinic, you educate the patient on what you are going to do. The patient lies down on the couch, you insert the speculum, and then what we usually use is the vinegar for the acetic acid. So you dip cotton in the acetic acid or the vinegar, and then use it to clean the cervix. That's for the visual inspection with acetic acid. So you use it to clean the cervix. When you clean it, after cleaning, then you dry it with a dry cotton. Then you wait for 1 to 2 minutes to see if the cells there are normal. It remains pink. The cervix is supposed to be pink. So if the cells there are normal, it remains pink. But if the cells there are abnormal, you will see white patches over there. Then you know that these cells are cancerous cells. Then you can go on to take the Pap smear or the HPV. And then when you are using Lugos iodine too, the normal cells over there will take the color of the iodine. They will become brown. And then the abnormal cells take pale. They become pale over there. And then when you see the abnormal cells, you can go on and then take you take a tissue for histopathology. So I think my colleagues will add more.
Okay, thank you very much. Please, the panelists, if you'd like to add more, just unmute and speak. Ilima's corner, your palm has been up for some time, so you can please unmute and speak.
Thank you. I just wanted to add to what Dr. Akofa was saying. Yes, those are like the stages, but I wanted to add to it because the recommendations have also changed in the sense that before 21, they don't actually recommend any screening anymore. So whether you're sexually active or not, like you're not getting screened because they found that before that age, there is a bit of colonization of the HPV virus in the younger population. So that is why they've changed it that like now you start at 21 and then the stages, like you said, every 3 years and then every 5 years after like 30. So before then, it used to be that before, if you're only sexually active, they will screen you before your age 21. But now all of that has changed. So whether you're sexually active or not, you actually don't get screened till you're 21 because, like I said, the colonization. So that's what I wanted to add to that.
Okay, thank you.
Also, sorry, I think also that they've changed because someone asked earlier about getting the vaccine if you're above 14. I believe they've increased the age for some groups. Like you can still get it. Maybe now it depends on the type, but I'm not so sure like what type. But some people can still get it above that age.
Thank you. Any of the panelists would like to speak? Dr. Abrifa, I think. Let me.
I think Dr. Priska is also unmuted.
Okay, Dr. Priska too. Please, you can add to the conversation. Dr. Priska. Okay, I think she's having some issues because her.
Yes. She had some few challenges when we were doing the test run,
Okay,
and I think it's similar to what we are experiencing now.
okay.
But
I think
she had said something. She had sent something. I don't know if probably we could read
okay.
it out.
Yeah,
She was saying that the oral contraceptives might increase the risk of cervical cancer by changing the susceptibility of cervical cells to high persistent infection with high risk HPV types. So just as all the other panelists agreed, so when there's the HPV and then someone is on the oral contraceptive, then there's a higher risk. Just as I don't know the other user's name, but she raised that, and all
Yes.
our panelists accepted. So Priska also added that through text. Okay,
Thank you.
so yeah, take over.
Dr. Gustav Dollar, your hand was up for some time. Please, you can unmute and add to what you you'd like to add. Dr.
Okay, Asabri.
Gustav.
Asabri.
Okay, I think there's a few issues, but I wanted to also ask based on my previous question. Okay, I think he's back on. Dr. Gustav.
Hello, good evening.
Okay, yeah, good evening.
Yes. So I wanted to make a point about the vaccines. Yeah.
Okay.
The vaccines. Hello.
Hello, we can hear you. Please go on.
All right. I wanted to make a point about the vaccines. That the vaccines, the reason why that age group has been chosen in this country is that we assume that people are not sexually active within that age group. And what the vaccine does is that the vaccine prevents new HPV infection, but it does not protect you against it does not protect you against the HPV that you've already acquired. So if yes, it does not protect you against HPV that you've already acquired. It will just protect you from getting a new HPV infection. So if you've been already exposed to the HPV and you have it in your system, getting the vaccine won't prevent you from, won't uh, cure what you already have, but it will just protect you from getting a new HPV infection. That's why it's most effective in preventing cervical cancer when it's given to people who are not already sexually active, because HPV, the high risk HPV types that cause cervical cancer are contracted through sex. So but the CDC recommendation still uh, uh, recommends that if you're up to 26 years, you can take the vaccine. Just that you know that if you've already uh, have gotten the HPV infection by then, the vaccine will not clear that HPV virus that you already have. It will just protect you from getting a new infection. That's something I want to add.
Okay, thank you very much. Dr. Priska, she's still connecting. At this point, if you want to ask a question or you want to say something, you can request or mute your mic and just add on. Dr. Priska,
Okay,
okay,
can
please.
you hear me now?
Yes, we can hear you.
Okay, so I wanted to add on currently, first the vaccination age was less than 21 years, but there's been a change. They've brought a new one called Gardasil 9, which covers a wide range of the human papilloma virus. Yes, so for that one, they give the chance to even vaccinate up to the age of 49 years. So it's no more, as I think Lima was saying, it's not no more for just non-sexually active people, but for both sexually active and non-sexually active. Yeah, that's for the vaccination now. And for Ghana, our sexually active age is even getting so fast, 10 years, 11 years. So we are no more restricting it. Yeah. So that's what I want to add about the screening. And for the HPV infection, as you were saying, it's not solely that you are preventing the progression to the cancer.
Thank you very much. So, we've had an amazing discussion up to this point. If you'd like to ask a question or any of the panelists would like to add more information to what they've said, please unmute and speak. And if you'd like to ask a question, you can request. So, I add you to the speakers and then you ask your question, or you put your palm up and then we move from there. Thank you.
I just wanted to add to it and also reinforce that if you're on this panel right now and you're listening and you're above 21, you should be getting screened. Like, find out about that pap smear and get tested, because cervical cancer is something that is so like preventable in this, because we have the avenue to, if you catch it early, take care of it before it becomes the cancerous cells that's your that is now getting to your bladder, because by that time mostly it's too late. So if you're on the panel or you're listening to this, find out, get your doctor, see how you can, get tested, because once they find early, you can take care of it. And every 3 years, it's just once every 3 years till you're 30, and then every 5 years, like they said. So just to reinforce that, because I know the point of this is for us all to learn, and also reinforce that it's not so simple or like so minute. It's a big deal, and if you have the opportunity to take care of yourself now, just do that.
Thank you very much, Lima. If anyone else would also like to add, please just unmute and
Say prevention is always better than cure. So let's screen. Let's get screened now.
okay. Thank you very much, all panelists. So, we're going to be doing more of these discussions and campaigns on cervical cancer. And if you'd like to follow them, which I think would be very good if you do, please follow the host, Doctor of Everything, Yalaj. And I will be now reading the tweets that were shared while we were having the discussion for those who came in late. So Karen Tread does not only recommend vaccination for non-sexually active individuals. Sexually active individuals can be vaccinated as well, and this was said by Dr. Priska and Dr. Lima. Vaccines will only prevent new HPV infection. People who have already been exposed will not benefit from it, and vaccination can be done in people who are not sexually active yet. Pap smear is described as secondary prevention of cervical cancer. The primary prevention is vaccination and elimination of the risk factors. Cervical cancer is usually asymptomatic in the early stages. This may go on to postcoital bleeding, that is bleeding after sex, bleeding in between periods, that's menses, and also in menopausal women. This was said by Dr. Akofa. Male partners can easily transmit cervical cancer, that is, they may carry the HPV virus. So, the use of birth control pills over 5 years can increase the chances of cervical cancer. That is when the HPV virus has been introduced in the woman. HPV basically overwhelms the immune system found at the cervix in the immunocompromised patients. Lack of ascorbic acid, that is vitamin C, may also be a risk factor to cervical cancer. The human papilloma virus, that is HPV, is the main cause of cervical cancer. This was said by Dr. Kofa at the beginning of the discussion. And being sexually active before the age of 18 predisposes females to cervical cancer. This was said by Dr. Kofa also at the beginning. And he gave us a few stats about it. And he said 550,000 people may be or will be with cervical cancer by 2030. And this was said by the WHO. 3,171 women were diagnosed of cervical cancer in the year 2019. and it is the fourth most frequent cancer in women worldwide. Every healthy and normal woman has a cervix, and it connects the womb to the vagina. So that is all that was shared. If you have any question, you may ask. You can also follow Dr. Yalaj to keep updates with the campaign that we are running on this topic, that's cervical cancer.